yourself. That's the
I
thing.
know.
I know.
Yeah.
It's a very distracting look at you.
I'm gonna look at you. Great. Are we good? Okay. Hi everyone. My name is Veena Sundaram, and you are attending a webinar for Cleveland Health Leaders: Stories of Public Health from Cleveland. As I said, my name is Veena Sundaram. Some of you guys may know me from doing all the social media, Facebook and Twitter and everything, and I will be moderating the webinar. Again, thank you for attending, and I'm very honored and excited to have our two speakers with us, Rachael Sommer and Melissa Federman. I want to take a moment to just give a short bio about them, and then I'll give them a chance to kind of expand a little bit more on the type of work that they do. So for Melissa Federman, Melissa joined the Center for Community Solutions in 2008 and serves as the Treuhaft Chair for Health Planning and Director of the AIDS Funding Collaborative. Melissa began her career as an HIV research associate at the Children's National Medical Center in Washington, D.C. Before relocating to Cleveland, Melissa trained with the Maryland State Department of Health WIC program and at the Centers for Disease Control and Prevention in the Reproductive Health Division. She has a bachelor's degree from Colby College and a master's of public health from Johns Hopkins University. And again, once we get started, you guys can feel free to elaborate any more on that. And for Rachael, I actually happen to work with Rachael at the Cleveland Department of Public Health. She is program manager for the Healthy Cleveland Initiative for the Cleveland Department of Public Health. Prior to joining CDPH, Rachael was assistant to Councilman Joe Zimmerman, and she is a licensed social worker and received her master's in social work from Case Western Reserve University. So real quickly, just a few things before we get started. So the format for this webinar is going to be pretty relaxed. People can feel free to ask questions as you want to. And we have a couple questions that we're going to present to kind of facilitate discussion. But like I said, if something comes up you want to ask while we're in the middle of a subject, feel free, no problem at all. And we will be live tweeting also throughout this webinar using the hashtag CLE Health Leads. Once again, that's CLE Health Leads. And just to do the social media plug, our organization, Cleveland Health Leaders, is on Twitter and on Facebook. So on Twitter, we are at CLE Health Leads. And Facebook, we have an open group that's just called Cleveland Health Leaders. If you do a search, you should be able to find us pretty easily. We're a public group. And if you are interested in membership, I would recommend reaching out to Ashley Hartman, who is, Ashley, if you want to.
She's here.
I would say Ashley is kind of, she's kind of like spearheading this whole initiative and project and the steering committee. So if you're interested in membership, we have a short form that people can fill out just about like what your interests are, what you'd like to get out of the organization. Membership is free, and you can just reach out to Ashley at cle.health.leads@gmail.com. Once again, cle.health.leads@gmail.com. Anything else, Ashley, you'd like to add? Anything that I forgot?
Great.
Okay, all right. Well, I'm going to kind of scooch out of the way so I can get some focused camera time on our guests.
You're in the hot seat.
Okay, so Rachael, I'll start with you. So I was hoping that you'd be able to expand a little bit on the type of work that you do with Healthy Cleveland, some of the projects and initiatives that you're working on at the moment.
Sure. So just for like a little bit of background, the Healthy Cleveland Initiative did start out of Councilman Zimmerman's office in collaboration with the mayor and the 4 hospital systems. It was in response to the study done by Dr. Anthony Eichen called Place Matters that demonstrated there's a 24-year life expectancy discrepancy between the neighborhood of Huff and the city of Lyndhurst. And so the initiative really came as a call to action or a response to that study. And being the chair of Health and Human Services, Councilman Zimmerman and the mayor felt like, okay, what can the city do to combat this issue that's going on? Our citizens are dying a lot sooner than some other neighboring cities, and knowing that it's attributable to a lot of things we can control, like access to active living opportunities, our diet, smoking, and behavioral health. That's kind of where we started in terms of focus. And from that's just to give a quick background, but that was in 2011. Now it's 2015. Things have evolved, and we've kind of opened up our focus to 3 additional areas: healthy neighborhoods, health literacy, and violence. And in fall of 2014, with the onboarding of a new health director and then seeing the need to elevate this initiative to the next level, the mayor decided to fund a full-time position to oversee this initiative. Fortunately for me, I was given that opportunity, and so now I'm in the process of kind of getting Healthy Cleveland to maybe where it should be, where we haven't had as much staff time or somebody to kind of oversee this initiative and bring it to the forefront like we had been hoping to previously. So currently we're in the process of working with some consultants and formulating a strategic plan and a communications plan, because I think one of the things that we haven't been as successful as we wanted to be was communicating our successes and what we have done within the initiative and where we'd like to go and really saying what is Healthy Cleveland. So really, Healthy Cleveland is intended not to be another program, but to be a platform where everyone who's working in public health or has programs or projects or advocating at any level, whether it be grassroots, policy, or otherwise, it can be that space to share and tell our story in Cleveland and really make the connections that maybe we don't make alone. Kind of like this group, you're trying to make connections between all these different public health leaders and what we're all doing and how we're impacting health. So previously, we've been really heavily focused in the policy arena. Councilman Simperman introduced a couple different pieces of legislation, no smoking on city property, trans fat ban, some internal things. We changed our vending contracts, things like that. But we want to continue doing those types of things, but we also want to expand and see how we can better integrate within the community at the grassroots level, and also with some of our other partners and across sectors as well, because we've been heavily focused on nonprofits and foundations and healthcare systems, but really trying to hear the voice of the community and what the residents want to see happen based on the data that we do have from places like Center for Community Solutions and understanding, right, in our EPI department, understanding what the health issues are, but then also what do people want to see, because our ideas of what should happen in a community might be very different than what residents want to see. So we want to make sure we're capturing that voice in everything that we do. Do you want me to highlight some specific things we're working on right now? Or I don't know how much time we have.
I mean, yeah, if you want to, yeah.
I'll just give like really quick 2 or 3 examples just to show kind of the breadth of the work. We have, like I mentioned, we have 7 different areas of focus: active living, behavioral health, clean air / smoking cessation, healthy eating and nutrition, healthy neighborhoods, health literacy, and violence. So those co-chairs of those committees kind of help formulate the goals and objectives based on what's going on in the community, the data, community voice. And I think we're going to refine that process of how we determine those priorities moving forward. But currently, for example, our Clean Air Committee is looking at introducing a policy called Tobacco 21, which you might have heard about. Other cities have implemented. Some cities have even seen up to a 50% reduction in smoking after implementing this policy. Also looking at a ban on flavored tobacco. And so like that group is very policy focused and feels that they can make a huge impact on that area of health as it relates to policy. Then we have our Healthy Eating and Nutrition Committee that's really focused on a Water First for Thirst campaign. And that kind of came about looking at the access of water in schools in our district. And the Prevention Research Center at Case had done some preliminary research in K-8 schools about kids' access to water during meal times. The federal policy identifies that students should have access to free, clean drinking water during the lunch hour, but just barely over 50% of the K-8 schools had that in place. And when you look at the issue, you don't necessarily, when you think about healthy eating, we know there's a lot of local food movement going on, there's a lot of healthy eating movement, cooking classes, but nobody really talks about water and the impact that water has on your health and also your cognitive skills and abilities. So some research that we found showed that a lot of students are coming to school dehydrated, not because they're not drinking, but they're drinking a lot of sugary drinks. And when you're dehydrated, your cognitive abilities aren't the same level as when you're fully hydrated and refreshed. So focusing on water, encouraging students and youth and everyone to make water their first choice for thirst is really not just one for eating healthy and lowering obesity, but also for cognitive performance as well. And it's something that we're really spending a lot of time assessing all of our rec centers and the entire school district, not just the K-8 schools, and looking at what the current access levels are, finding grants, funds, sponsorships to improve that level of access and engaging the community around a campaign, letting them define why they think it's important to drink water. We're going to do a campaign, a slogan, a contest in the schools with the students, let them come up with a poster campaign, just different types of stuff. So like when you look at like clean air and you look at healthy eating, it's like very different, our approach, but all of these, that's the great thing about this initiative is that we can be very out of the box. We don't really have a lot of rules per se about how we have to go about addressing public health issues. So that's really exciting. And I talked a lot, so I'm going to stop.
No, that's okay. No, this is all really good information. I think it's important for people in Cleveland to know what Healthy Cleveland is doing in the different projects. So that was fantastic. Melissa, I will let you go ahead. You're fine. Definitely talk to us about some of the projects and initiatives and the work that you do.
Yeah, absolutely. Well, I've been with Center for Community Solutions. This is my 8th year, and I've worked generally on sexual and reproductive health at the center. I started with Title X and had a more discrete grant-making role at the AIDS Funding Collaborative, and then a few years ago moved into full-time work with the AIDS Funding Collaborative. The AFC, for those who aren't familiar with, really great convening body, is a collaborative literally of 7 local funding partners, private and public, and it's previously St. Luke's was involved, but Mount Sinai, Gun Foundation, the Cleveland Foundation, the United Way, and then our local city, county, and Adams board. And they pool dollars, and we do grant making in the community, really focused on building capacity of frontline providers and filling gaps, basically where other public funding and other really restricted funding streams can't reach. So an example of that, for instance, is the local syringe exchange project, which has been running out of the free clinic for 20 years, and that's actually the exact amount of time that the AIDS Funding Collaborative has been convening is for the last 20 years. So although the epidemic has certainly changed in the last 20 years, so has the need in the community, so has to some extent the population impacted. And so the AFC at this point continues to do grant making, but a couple of years ago we were given the opportunity of really leveraging our local dollars to bring an AmeriCorps program to Cleveland. So it's a different way of building capacity in local organizations, it's a great leverage of our dollars. And when you're talking about filling gaps, that's really what the organizations who apply to host AmeriCorps members do. So we very much play the role of matchmaker. So we are a local partner of a national organization, AIDS United, that has 54 AmeriCorps members nationally over 7 operating sites. In Cleveland, we're lucky enough to host one of the operating sites. This particular AmeriCorps program is the oldest and largest HIV-specific AmeriCorps program in the country. And we've been growing our team steadily. So the first year, we had a team of 5, and this current year we have 6, and for next year we anticipate a team of 8 service members. And organizations apply to the AIDS Funding Collaborative very similar to applying for funding, but in this case they apply for a service member, and they provide a position description of what the member would be doing at their organization. There are 6 different service categories that they can include, including outreach and education, more prevention role, client services, healthcare access. So they do a number of different things, and often many different services for an organization if they're housed someplace like the Care Alliance or Metro Health, where they provide both prevention and services for people living with HIV. But these members have an excellent opportunity to really get their hands dirty in a public health setting. They learn a lot about HIV. The training is really amazing. And we really look at it as a workforce development program too for the next generation of health leaders. So that's been a really exciting add for the AIDS Funding Collaborative. Also in terms of filling gaps and building capacity, which is sort of really our theme, we do trainings in the community. So we bring in quite a few trainings annually, just depending on what's needed. So often we'll bring in national speakers. We have, this year actually we will be repeating a session that's been really popular called Smarter Sex 101 and 201, and it's literally 2 days, but it talks about just risk factors associated with anal sex compared to vaginal or oral sex, and just really allows, after this training, frontline providers a great, working knowledge to share with their clients. We also this year are doing a training, the first one actually in this area, on pre-exposure prophylaxis, which is a really important new prevention tool. New-ish. It was introduced, FDA approved in 2012, but it's been a slow rollout, I'd say. But the research just keeps coming and is better and better about basically showing that by taking essentially the equivalent of a pill a day, so it's an antiretroviral, but you can take prophylactically, you can reduce your risk of HIV acquisition by over 90%. It's really exciting. And it's one of those tools that not everyone is aware of yet. So we're doing a training. We have a lot of local experts, which we're really fortunate to have. So they're going to be doing, actually it's a week from Friday. If anyone's interested, you can reach out to me. We do still have a couple seats available. But we have some local experts who are pooling for their expertise for a half-day training. And, CEU is always provided, but it's really for frontline providers, again, HIV testers, who we know see folks who are at risk for HIV, repeat testers, and also for folks who work in a clinical setting. So PrEP is also recommended for individuals who have tested positive for an STD. There are a handful of different criteria. So PrEP is something that we're really excited about and we'll be working on this year. And then at this point, we're also focused on, at the Center for Community Solutions in our health programming, increasing access to long-acting reversible contraception. So LARC methods, including IUD and implant, have been shown in now a couple population-level studies that when they're offered without financial barriers to women and with appropriate education about their effectiveness compared to other methods, they are widely accepted. The continuation rate is great. And so we are really working with local providers of all sizes, Title X, family planning, safety net providers, FQHCs, hospitals, to help them implement practices, clinic flow practices like same-day procedure. So you go in and you're interested and you can literally leave with your method. And, education and starting to educate around family planning methods, starting with the most effective method. There are a handful of things that may sound obvious, but aren't in practice right now and have been studied at this point and shown to make a huge difference in the uptake of these really effective methods. In the places where it's been studied, the teen birth rate teen pregnancy rate actually, I should say, has gone down 50%. The abortion rates have declined substantially, and unintended pregnancy rate as well. So, these are methods that are very acceptable to women when they have education about them and have access from, really a financial, but also when you think of like transportation, not having to go back for several visits, things like that. So we're really excited to move that work forward and increase access to LARCs locally. We're also very excited. We are still in the planning stages, but it looks like we may have a national campaign to end teen unintended pregnancy, social media campaign to raise awareness about LARC methods and so to raise awareness and positive regard for the method. So hopefully that will kick off in probably about 6 to 9 months, and will support what the clinics are doing and will increase demand for the good work that the clinics are doing. So LARC has been a focus of our work. And then we also at the Center for Community Solutions under our health portfolio host the Collaborative for Comprehensive School-Aged Health, which is a network of youth-serving organizations that work together to advocate for age-appropriate K-12 evidence-based, what is known as comprehensive sex education access for students in the region and really around the state, depending on what the policy target is. And then also the Advocates for Youth project. And there are 5 Advocates for Youth projects nationally, and they are supported by the Advocates for Youth organization, which is located in Washington, D.C. And for that program, we actually very similar to the AmeriCorps program, we recruit a cohort of youth. But in this case, their focus is really about identifying and working on their own policy targets related to comprehensive sex ed and other reproductive health and justice issues. So we have a bunch of projects going on, more, I would say, focused, so sexual and reproductive health. We don't have quite the breadth that Healthy Cleveland does, but it's been exciting work, and we have some neat opportunities ahead of us this year.
Awesome, fantastic. Definitely moving forward, as you guys, if they're talking about things that you guys are interested in, I would highly recommend reaching out to either of them, and we'll have them provide their contact info at the end of the webinar and everything.
And the PrEP training,
Oh, yeah.
You say it.
Yes,
Sorry.
and the prep training. I think this is the prep training is a fantastic opportunity. And I remember putting up a link on our Facebook group. So if you guys are interested in that training, go to that Facebook group and you should see a link for more info, how to register, and everything. All the information should be up there. So,
And we will also likely be holding, actually not likely, we will be holding at least one more because we know there's quite a bit of interest in the community. Actually, one thing I didn't note that is very exciting is that 3 local service providers, Care Alliance, Recovery Resources, and Planned Parenthood, just found out that they received a huge CDC award for HIV prevention, high impact HIV prevention for the next 5 years. And it's really doubling the local budget for HIV prevention. And so also to help support their work, we'll be providing some other trainings as they need in their planning year.
That's
So it's been
fantastic.
discussed.
So as you guys can see, anytime there's a federal funding involved, it is very, very exciting. Okay, so I guess the next question might be how you came into working into public health, why you wanted to get into public health. Talk a little bit about your educational background and kind of your career path up until this point. I guess whoever wants to go first.
Okay. I had no idea I was going to get into politics or public health or any of that. I knew I wanted to help people, and so I went to social work, and I did my undergrad at Bowling Green and did my master's at Case Western. Are you a Falcon?
Yeah, roll along. Right?
So great school. But okay, so I went to MSAS in community and social development. I really wanted to do community organizing, and coming out of school, I ended up taking a job at mental health services, now Frontline Services, doing in-home family preservation, family counseling work, referrals from DCFS, the Department of Child and Family Services. And one of the things that I noticed, it was actually a wonderful learning experience, and I'm glad that I did that as my first job out of school, because I was seeing time after time again, we weren't able to get to these like deep-rooted issues, the counseling issues, because we're dealing with so many, we call them, I was thinking about this earlier, we call them basic needs, in that work or line of work, basic needs issues like food and jobs and transportation and stuff. But I just think about it now, I'm like, these are just needs. These are quality of life issues. They're so integral to everybody's success in life. Like you can't, if you don't have the access to a car or a bus to get to your job, then you're not making money, and it's just impacting you in every facet of your life. And it was very disheartening at times to see so many issues at many levels, from the bottom on up structurally, in the system that were impacting my clients. And I felt at times, and at least at that point in my life, being young, just out of school, not knowing really how to navigate folks to bigger solutions. Like I felt like, how can we do more at a greater scale? And through a series of events, ended up meeting Councilman Simperman, and when his former assistant had left, he called me back up for an interview. I had no idea what I was getting into. I'm telling everybody now, so it's out there, but at the time I didn't even know who my own councilman was. Like, that tells you how far from politics I was. But I've learned a lot, and he's actually the chair of Health and Human Services Committee for City Council. And I kind of went into the job thinking, I'm going to kind of dabble in a lot of different places and kind of find my niche. Maybe I'll get back into, maybe I'll work for a community development corporation. I don't know what I'll do. And I just fell in love with health and population health issues, and understanding that where you live impacts your health, and how all these different things that I saw my clients experiencing every single day were impacting how long they're living and their quality of life and their ability to function successfully. And then I was able to see at the political level what we can do as local policymakers to change that for our citizens, and how hearing from our citizens and hearing from people like the AIDS Funding Collaborative, what is actually people are experiencing and where we need to put interventions in to make a difference. And at every level, it's not just setting laws and policies, but it's going to the block clubs and seeing what people are doing in their neighborhoods and how we can be of help in that way, because they're really the ones that know what's going to make the difference. So all that to say, at the time, I didn't really see myself getting into public health. I just knew I was passionate about this stuff. But the more the Healthy Cleveland Initiative grew, and you just see how much health is everywhere and how everything you do impacts health. And I realized that's what I was passionate about. And when the opportunity came to work at the health department, overseeing the Healthy Cleveland Initiative, it was just made total sense for me to try to go for that because I see Healthy Cleveland as like my baby, and I've seen it grow from like a little sprouting to grow to big, and I want to see it continue to grow. But it's not about the initiative. It's about seeing equity for our residents and seeing that everybody in our community is going to have the same opportunity and same access as somebody who lives in Rocky River or Westlake. I find a lot of times that I meet people and they seem to be so defeated. They have a defeated attitude, like there's no hope for me. Like, this is my condition. This is where I'm at. And I have no choices. I have no options. And it really just makes me sick to my stomach because it's not right. Like, everybody deserves that. We live in a beautiful city with so many resources, but we don't always connect them the way they should be connected. And we don't empower people the way we should. I mean, I know a lot of us are working on that, but we got to do more all the time. We got to try harder because we have smart, brilliant, wonderful, engaging, funny, like innovative people. And we have to highlight that. We have to give them the tools and resources to do what they know what's best for their community. So I don't really know if I answered the question, but that's how I got it. I'm sorry, I got off on like a tangent. But.
No, it's good. No, I think it's important for especially people coming into public health to see the passion and kind of understand like what's happening. So this is great. Don't worry, you're good.
It's like clinical needs population. There's a clinical health need for sure, but then there's just so much more that is wrapped up into that. I think that a lot of us are getting now, and we're pushing that movement forward. How it's all connected. So I don't know.
And Melissa, I'll ask you the same question.
Oh, sure. So as far as my career path and my background, I also did not anticipate ending up in public health. I hadn't actually heard of public health while I was completing my undergraduate degree at Colby University. No, it's a very small school, and it was a wonderful school, but with more limited at the time majors. And so I was a biology major, and I went after that, back home to upstate New York. I could not do anything with a biology major as far as employment. Ended up finding great opportunities in Washington, D.C. and relocated there. And ironically, my first lab project had to do with adolescent HIV, but it was basic science, bench work. And I met, several years, there's actually someone in my office who had their master's in public health, but I would have never gone after it because I didn't really like that person's job. It didn't seem that interesting to me. It's more administrative. And, but I ended up, a friend of a friend in DC ended up taking public health classes, and hearing about what she was learning sounded so wonderful. And I wasn't exactly sure that what I was doing at the time, which turned out to be, I went from an immunology lab to genetics, and I wasn't exactly sure that I wanted to do genetics for the rest of my life, but I wasn't exactly sure what I wanted to do. So I took a few classes actually unmatriculated at GW. Totally fell in love with public health. I loved epidemiology. I loved sort of that, that's sort of like the heart, the science of public health, but then also just seeing the world through the prevention lens made sense to me, and it still does. And so I ended up applying for full degree programs, and we moved to Baltimore, and I went to Hopkins for my program, which was wonderful. And then you heard from the bio, I jumped around. That's when I worked at the State Department of Health. That's when I was in Maryland. And then we moved to Atlanta. So I was able to train at the CDC. They have a lot of wonderful internships and fellowships, and I'm sure many of you have been through them and looked at them, but it's a wonderful training opportunity. You might think working at the federal level, like, oh, so much bureaucracy, but you're surrounded by like-minded individuals, and regardless of what is going on with the politics that might surround the issues you're working on, it's a wonderful place to be. And so I went from Atlanta to Cleveland, and actually volunteered. I know we may talk about volunteering later on in this discussion. That ended up being a very important transition step for me, because Cleveland and really Ohio was such a different beast from the standpoint of public health and public health opportunities than what I had seen on the coast. And a lot of it has to do just with, there's a lot less funding. And I moved about a decade ago. There's a lot less funding coming to Ohio. And the state puts aside a lot less funding than other states do for public health initiatives. So there just wasn't the funding. There were fewer schools of public health. They weren't, cranking out, individuals with public health degrees and placing them in agencies for practicums and things like that, so that agencies could see, well, what do you do with someone with a public health degree? So my joke is when I moved to Cleveland, I think I was one of 3 people with a master's in public health degree. And truly, folks weren't really sure what to do with me when I tried to do informational interviews. But at Community Solutions is where I landed actually to volunteer. I ended up getting paid employment probably 6 months later with Anthem Partnership Plan, which is a Medicaid managed care organization. And it was a great opportunity. It was really a startup, getting the program going around the state. And they had a public health presence in all of their offices. And so that was me for the Cleveland, regional office. And then when they decided not to continue their work in Ohio, I was in touch with Community Solutions, and they were in the process of creating a position just like the one I started in. So I was really lucky to be able to interview and return to Community Solutions, and I've been here since. So it was not a totally linear path, but there's something about I think getting the public health bug, and it's really hard to see the world's any other way. I mean, and it's funny because even when I think of education or, transportation, I still think of things in terms of prevention. So I do think it's a neat lens to see the world through.
And since you touched on it, we might as well get into it. So how can students, regardless of whether they're public health students or social work students, whatever, whatever subject they might be studying, what do you think are some really good ways here in Cleveland for them to arrange to get volunteer experience, practicums, internships, whatever advice you guys have about that?
Sure. Well, I know if they are matriculated in the School of Public Health, there is a capstone project. There's actually a capstone and a field experience, and I forget what they call it. But there are 2 different options, and you can do them both with the same organization or have them as 2 separate experiences. So I do know that particular program does place students in the community, and I think does a nice job with that. Also, I know at John Carroll, they have a minor in public health, and they also place students in the community. So I think it's really nice if you're in a public health program, and you can probably speak for social work, that they do have those connections in the community. So that's a great, at least, entree. If a student is interested in X, Y, or Z, then they have some partners in the community. That said, I've definitely, I don't know that I've ever, and correct me or call me if I have, turned anyone down for an informational interview / a coffee if they've moved to Cleveland and just don't have connections yet, because I know I really struggled when I moved here and not having quite the infrastructure that I had seen in other places and was sort of expecting, there are hospitals, so there's all these public health jobs. And there were, but there were other people doing them. There were nurses and social workers, and that was great, and the work was happening, but I just didn't have the right degree. I didn't have the great, entry level degrees. So whenever, I get one of those calls, I try to meet with folks and help them network to the extent that I can. And there are a lot of folks in the community who will do that. So don't be shy about asking. But also, I always recommend volunteering. And I've seen several different individuals do that. You don't have to volunteer full time. It could be a few hours a week or half a day while you're waitressing or doing whatever else, working part-time. But it's a great opportunity actually to get to know organizations too, to see what you like, and without having to commit. I mean, there's some real benefits to volunteering. It's also obviously a way for an organization to get to know you and to build some local connections for recommendations, et cetera. So I think there's a lot of benefit in volunteering and going through practicum, and all of those experiences.
Yeah, I was just going to echo what Melissa said. In Councilman Simperman's office, we had so many different students from different backgrounds come in, and we were able to show them so many different sectors and different ways to get engaged and plugged in. I am totally, if anybody is looking for a practicum or internship, I am dying for interns. And I have lots of, actually, Vino came up with a capstone project idea for something we're working on, collecting data in the neighborhoods about what folks want to see around health and what's important to them around health. But that's, I think, what's cool opportunity about, I'm just plugging my initiative right now for a minute, but is that there's just so many ways to plug it in, from no matter what background you're from. Even I went to a conference or spoke at a conference for CPAC around arts and culture and how art touches health and how there's ways that business touches health. Everybody has a role to play. So I feel like there's an opportunity for you within Healthy Cleveland to be engaged in some way. Like I just had a meeting with Art House about possibly doing a program around water, doing some kind of mosaic around water in one of the schools that we're going to work with to promote this. If you're really interested in data, like there's a lot of need that we have for data and epidemiology, statistics kind of stuff. If you have a specific card about a specific issue around youth violence or childhood obesity, like there's a lot of opportunities. And even though we have such a wonderful group of committed individuals, they all have full-time jobs and they're doing this is like because they're passionate about it or there's an alignment with their organization. The only person whose full-time job this is me, really. So, and there's a lot of things that I think would be a great learning experience and helpful to the initiative, helpful to the health of Cleveland, and helpful to students or folks who are trying to get their feet wet in this field. So I think it's only of mutual benefit. I'd love to talk to you about some ideas or opportunities. And again, for networking, we have so many different organizations, and I think really understanding how diverse this field is, because even looking at how different our two positions are, but how important they both are to community health is really exciting. And you can see like how foundations are impacting health, or how hospitals are impacting health, or social work. Everybody in some way is touching on it, but it's different. And I know, like, even just speaking about the social work field, when you're in school, you don't really know how you get involved. All you hear is like, you can be like a caseworker or like take kids out of their homes and stuff, but it's like not true. There's so much diversity, and it's really exciting to see that there's kind of something for everyone, no matter where your heart is or what you're passionate about or what your skill set is. So lots of folks that I could connect you to or share what they're doing, what their organizations are.
Fantastic. Okay, so next question is, and this is, I guess we can take this in two parts. So what are some of the biggest public health challenges and successes here in Cleveland? So let's start with successes. Your guys' opinion. Who wants to start?
We have Healthy Cleveland.
I mean, that's true.
She won't say that. She's too humble, but that's exciting. I mean, I would also say we have the ASC. It's not, I mean, there are only about 20 like organizations around the country now. And part of it, you might say, is because there isn't more state funding, and there isn't, you know, that you kind of have to, you need these sort of exceptional models and, you know, exceptional conveners, right, to get these programs going.
And people who believe in collective impact and understanding, because the problems are so complex and so big that the only way we're going to make a difference is by working together, using our unique skill sets, assets, resources, and combining them for just like massive impact. And I was just going to say also passion. You know, I don't know. I've been to a couple other cities. I haven't been to a ton of other cities, but the people here are so passionate at every single level. And I especially want to highlight our residents. Our residents are doing amazing things. I'm always constantly meeting new people and learning about how they've gotten engaged in their community or led an initiative in their community. And that inspires me every day. It's like, even though I mentioned there are a lot of people who feel defeated, there's a lot of people who are like, there's no limits on me. This is my community. I'm taking it back. This is what I'm going to do about it. And that keeps the momentum going, and that keeps the impact going. So I think we have a great story to tell, and having more platforms to share that story has been awesome, because we're starting to get attention from across the nation and in the globe, really, about the quality of life here and the innovative things that we're doing around health. You know, there's a lot of challenges still, but we're constantly thinking of new ideas and igniting our partners and our neighbors around making impacts. So there's a lot to celebrate.
And I agree with that. Definitely, those are great successes. The challenges now.
Well, it's hard. I mean, I feel like some of our greatest successes, like on one hand, we've really done a great job reducing infant mortality. However, we have not done it fast enough, or certainly not as fast as a lot of our counterparts nationally. And now we have, unfortunately, a lot of really negative attention, and we have work to do. So I feel like it's always the other side of the coin, that it's so hard to finish something. It's hard to get to zero, is what we talk about in the HIV field now. So on one hand, in Cleveland with HIV infections, like, we are stable. Like, you could celebrate that when you look at Cincinnati or Columbus or a lot of other cities around the country, but it's getting below that endemic rate. So is it success that we don't have increases every year? Absolutely. Like, it's absolutely, I would say, a success. The syringe exchange, we have very few, from a public health standpoint, we have very few new infections attributed to injection drug use, and that's wonderful. But then, when you have these endemic rates, how to get below 200 and how to get to below 180. And that's when you talk about tools and tool belt, you really need them all. But I feel like that's always the other side of the challenge coin, is the like, well, there's a success, but like, you still have this work to do.
And I'll just add, I think sometimes just bureaucracy and red tape is what I see a lot of times. Is there's a lot of people who have a lot of good ideas, evidence-based, like they're ready to go, and they just get bogged down by all these different steps and permissions and politics and egos sometimes, and not naming anybody or anything, any institution specifically, but sometimes we just got to get out of our own way, and we have to realize that at the end of the day, a win for you, a win for me, is a win for us, is a win for the community. It's not about our own self or organization or institution, but it's about impacting the quality of life for our residents. So the more that we work together and put everything else aside, the greater impact we're going to have. And I think we're working towards that, but sometimes you still see it rear its ugly head, and it can be a little disheartening, because you meet so many people and you're all saying, like, we just want to get the work done. We just want to work and do what we're here to do. But you have to consider all these things, and you have to be very careful with how you act or what you say, because that could impact your end goal. It's more important to not worry about being right, but to win. And so sometimes you eat the bullet, or I don't know how you say it, but you accept this extra stuff, this, I call it drama or whatever, because at the end of the day, less babies are dying, or less people are being infected with AIDS, or somebody felt empowered today. So it's worth it to put up with that stuff, but the more we can reduce it, the better.
Well, the other thing I would say, and this is not unique to Cleveland, is the silos, right? And part of it has to do with funding. Like, there's a lot of good work being done across the community. It's not all being done by the same organization. So and then that's, that there's a lot of reasons for that. But it's even, I know we've struggled even just to integrate STD testing with HIV testing, because they come down in separate funding streams. And it seems like really basic stuff, but it can be really tough for organizations to tackle, and it's something that we're constantly looking at.
I think both internal and external. I think even we've been having discussions about Healthy Cleveland and what we're trying to do, and how it interacts with the different parts of our health department, and what some of the programs that are going on there. And I'll be the first to say, I don't always know all the intricate details of what our program managers are doing and how it's connected, but there are connections. I do the best I can, but there's definitely room for improvement. And I think with our community partners, it's like, even though we get so tired of going to meetings and talking and networking and stuff like that, you really have to, because there are people doing amazing things. And I'm constantly in a meeting and I'm like, did you know about so-and-so? They're doing that. And they maybe sometimes they are, but a lot of times they're like, no. And I'm like, you guys definitely need to connect, because I see the points here. And there's been several instances recently. I was actually just meeting with somebody today, and we were talking about, like, we're going to get together. We're going to do this, like, mind mapping, because I see we're both focused on this right here. And you know about some stuff going on here. I know about some stuff going on here. And we're actually going to list down all the touch points and the disparities that those different projects or initiatives that are happening are impacting in a specific community, and how they're related, because like you said, we gotta break the silos, and sometimes it's just unintentional, because it's like you're so busy in your day and you're just trying to get stuff done, and you don't stop to, like, learn or hear what's happening. But when you do, that constant communication impacts so much better.
That was a great answer. So let me see here. So So you guys are a little bit seasoned. You guys have some experience under your belt.
I'm still learning a lot.
What advice would you have for professionals who are new to public health, whether it's somebody who's transitioning from one career into public health, or even somebody, a new grad out of a public health program or a social work program? What kind of advice would you guys have, especially for ones that might be in the Cleveland area?
Get engaged. Get engaged at every level. I know we're all busy people and it's hard to come to things at night and go to community meetings, but the more you can integrate yourself, or at least be diverse about where you're the different projects or initiatives you get involved in, the more it's going to help you see where your fit is or understand the landscape. And going to like a ward club meeting that's happening in the neighborhood level to Metro Health just had their
Annual
meeting, learning about what they have going on, or stopping in an AIDS funding collaborative meeting, or asking to be invited to one of those to hear what the landscape is, because you got to see the big picture, and there's a lot going on. So you kind of got to put in the hours to hear what's happening. This is, if you're interested in culture change and population health and seeing the landscape change, you got to put in like the grueling time, hours, and efforts, and understand at every level, from the grassroots to the grass tops, what's happening. So that, and just be open to learning. Take the time to learn. It's hard sometimes. Like I myself, I don't want to go to do this training because I'm so busy with other stuff I got to focus on. But like sometimes you really need that to be able to further advance the work you're trying to accomplish. So just take a step back and take the time to learn, and be humble and be open and be willing to work with others and hear what they have to say, even if it's different than what your feelings or your background is.
No, and I would piggyback on that with the grass top, so to speak, the policy making level. So I feel like the engaged in the grassroots is excellent advice. The other piece I would say is follow the money, and where it comes from, and know what your funding sources are and what are the politics around it. And because when you think of where funding is available to do what in your community, it's in someone's budget somewhere. It's in the CDBG budget, it's in the state, the Ohio Department of Health budget, but there are ways to influence that if you think that it needs to be spent differently. So there could be more money there to do more programming in the community, or there could be, sort of regulation around it that could basically be better from a practice standpoint as far as you're concerned. So I feel like pretty much almost as important as sort of the grassroots and knowing what the community needs is also knowing sort of what the grass tops and the decision makers are doing with your program funding, and what are the politics around it, and how can you influence it? What are the levers?
And I was always amazed, sitting through budget hearings and looking at where funds are going and how they're influenced. Like Melissa just said, I had no idea prior to working with Councilman Simperman that we had community development block grants and what they were used for, and how, and this is just one funding source, so I'm just speaking about this specifically, but folks advocating from different organizations or even from the resident level saying, hey, this is a need out here. Will you give us X number of dollars to do this? And the council member can consider it and say yes or no, or here's why I'm going to give a little bit less than here's why. But that only happens if you say something or you share why. When you say, look at our trends, look what's happening. This is what the data shows, and this is why. And funding the LARC or the LARC programs or something, this is how it's going to impact our community. They listen to that. They really do, because ultimately those decision makers, they're responsible for those communities. So, when things don't go well, when you hear about infant mortality, they're asking those policymakers, what are you doing about it? So they have to answer to the people. So you're right, Melissa's totally right, knowing what's available and how to advocate for your Project Passion program is important.
All the above.
Yeah.
I think this next question might have something to do with this. What differences might be expected in finding and applying for jobs in the private sector versus nonprofit versus government? And if you want to highlight any differences between the three sectors. And I'm sure funding is part of that.
If there's a job to begin with, for sure. I think the application process and I've worked across the three, so private, public, and nonprofit. sectors. I think the application processes are similar and rigorous. I honestly think it's really office to office what happens once you're on the inside. I think
And who's
folks,
in charge?
I think folks would be surprised. I mean, I think you have conceptions about what something's going to be like in the private sector. Oh, you're going to have all of this funding. And it's like, yeah, but the private sector they don't write grants. So you have what you have, and that's about it. I mean, so I feel like the red tape, I think is something different that comes not only with the public sector. For sure, I felt that more so actually at the state level for me than at the federal level. And I think, again, it depends on your office and I don't know exactly what are all the levers there, but bigger, you might just be in a big organization and there could be red tape. So I really feel like it's the size of your office, it's who you're working with. So to the extent that you can get to know a team and a supervisor and all those players, before you accept a job, will be hugely important, I think, because it really will impact the experience. I think more so than just being, in what sector you're in, essentially.
And I think just accept that like no position, there's no one easier than the other. Like Melissa was saying, I work with a lot of different partners in the community, and I hear a lot of common themes that I think we all experience that I thought maybe were some things just externally experienced or internally experienced. But like you said, I think team dynamics are important and communication, and the more you can have clear, confident, respectful communication among wherever you're at, that helps them to know the expectations ahead of time and to know procedures and processes. That kind of helps at any level. And I think the interesting thing about working in the public sector and working for government is just understanding how interconnected you are. Like you might be working in one department, I'm with the Department of Health, but how interconnected you are you're just like a spoke on a big wheel, and everything you do is gonna help stop or keep that wheel going. And so it's not just about your individual department, but it's about the whole. And it's probably like that in other, you might be like, for example, when I worked at mental health services, I was doing family preservation, but there's, I had some clients that were also clients of, substance abuse counselors. And it's like, you have to stay connected to all the pieces and keep them rolling. So I think there's a lot more similarities than people think. It's just different levels and different layers and how many layers. So sometimes people prefer to be in the larger system, but then sometimes people feel like it can be, you get lost in there. But then sometimes when you're in a smaller system or a smaller nonprofit, it's harder to go as big as you want to do or some of the dreams you want to. But you're at grants at the health department. I can't speak for every department at the state, but we're so grant reliant. And you have to be, having that skill set I think is huge, and it'll help you no matter what area you're in or where you land. So I don't know if that answered the question.
No, that was fantastic. And one quick one, certification in public health. Any thoughts about that?
I have no idea. I'm aware that it exists.
Me either.
I'm aware that it exists.
thought
I
about
haven't
it.
personally needed it to move forward in my career, frankly, and I have considered it because I do think there has to be a benefit in that having to keep a certification up, you stay current, right, across issues. But to be honest, I haven't looked into it myself. So
Me either, although I have considered, because I'm like, after knowing where I'm at now, I'm like, wow, I wish I would have done like a dual master's in social work and public health, and what are my options now? But I kind of think it's the cool thing about our field is that there's a lot of people working in public health from a lot of different sectors with a lot of different educational backgrounds and career backgrounds, because again, I know I keep harping on this, but like we all have a role to play in health. So as long as you see your role in that, it doesn't really matter where you came from. I mean, as long as you get the core value, which is we all have a piece and everything you do impacts health at some level. So I don't know. I don't have a lot to say about that either.
No,
So
that's
sorry.
fine. I mean, I'm
somebody
always
who's-
interested. I think we're always interested to get people's perspectives on the CPH. Because some people are like, what's the point? Some people are like,
And it may just depend on where you are and where you want to go.
Right.
Right. I really think any job, I mean, no matter what job you're trying to get, whether you're in public health or not, I hate to, people used to tell me this and it would irritate me, but it's kind of like all about who you know. And I don't mean like people doing you favors, but like how you get connected, because I've seen people come with backgrounds in like accounting and now they're running, community development corporation, something like that. It's just about finding your passion, finding your skill set and applying that in any situation. I think just knowing yourself and knowing what you're capable of and where your heart is can kind of take you there.
So we are coming up on 7:30.
Whoa!
So
went by
yeah,
fast.
like super fast. So thank you guys again.
Thank you
so
both
much
and everyone out there. I don't know where to
I
look.
can get you all in, but
You guys had a lot of great information that I think everyone's gonna learn a lot from. So if people, no, I think it was. I feel like it was. So if people want to reach you,
Text me, beat me down, just hang so my email and text are great. I'm gonna give you my cell phone. I'm not even gonna give you my office phone because just don't. My email is Rsommer, SOMMER, no S at the end, at city.cleveland.oh.us. My cell phone, you can text me, call me. Texting is great though. I do really good with text, which my grandmother wouldn't like, but it's true. It's 330-635-8047. Seriously, I don't care who has my number. Just reach out. I want to get you involved and help you and help us, help Cleveland, however we can do that.
Ditto. My email is MFederman, FEDERMAN @communitysolutions.com, although we're a nonprofit, but communitysolutions.org was taken when we changed our name.
Interesting.
Yes. And I have an office phone, which no one uses, but I see the red light and I check my voicemail. So it's 216-781-2944, extension 440. And also my cell is 216-338-4020. And I also do well with text. I was told today that my voicemail is full. So that may be your only option. I haven't had a chance to go through and clear it out.
fantastic. So we will definitely have their contact info up on the
Twitter and
Facebook group.
Facebook. Healthy Cleveland has a Twitter,
Yeah.
/ Healthy CLE, and the Facebook is facebook.com / Healthy Cleveland, I think. But the Twitter is Healthy CLE, and we will. Oh my God, I'm hoping by like September, October, we're going to have a new website, new logo, everything up. But when we finish our strategic plan and communications plan, and really want to, like I was talking about, one of our biggest areas of opportunity is telling the story, what is already happened and what's going to happen. We don't tell the story enough. So I think Center for Community Solutions also has a Twitter, right?
We do, although I don't know it offhand, which is terrible in this age. But it's actually ironic because we just determined that we were going to have a our own health account too for the Center for Community Solutions, and research has its own account and policy has its. So we have the Community Solutions account, but our staff has been inundated with keeping up with all of us.
So hard.
So we will have our own. So I will have my tutorial soon and be able to better answer that question. But our website is communitysolutions.com, and you can actually find information on all of the projects I mentioned there.
And we can share, we'll share everything on our Facebook group.
A lot of this stuff
we've already retweeted, and so we'll tweet.
Yeah, we'll just continue, basically.
We know. So.
Well, thank you guys
Thank
both
you,
so
thank
much
you.
for this.
Thank you.
And like I said, we'll have all the info up on the Facebook page. And thank you guys for attending and watching. And I hope you guys have a great night.
All right, bye.